Good afternoon. My name is Ushin Walker, and the date is November 1st, and the time is 12:15. And today I will be performing a Foley catheter on a female. Right? So now that I've got all my supplies that I'll need for this procedure, I'll go in my patient's room, introduce myself. Hi, my name is Ushin Walker, and I'm a nursing student. Can you please tell me your name and date of birth? I'll make sure my patient verbalizes this information with me. So my patient name is Egbert Livingston, okay? His name is Egbert Livingston. His date of birth, he also verbalized that to me also. Okay, cool. I'll then explain the procedure that I'll be doing on my patient. So today, I'll be performing a Foley catheter on you. When was the last time you voided? My patient states that he voided 2 days ago. Did you ever receive a Foley catheter before? He says no. Okay, now I will make sure I wash my hands. Provide privacy for my patient. I will pull back his blanket, or in this case, we're performing on a female, so it'll be her. Set in the proper position, and I'll make sure my bed is at proper height. I'll use a bath blanket to give my patient more privacy, to let them feel like they're not too exposed. Okay, and at this point, I will take my kit, place it right at the near end of the bed, and I'll use this bag that the kit is in for my disposables, and I'll make sure my patient remains, don't kick up or anything to disturb my sterile field. So I'll put this bag right here, make sure my patient is aware of it also. Now make sure that this is my sterile field, so it remains sterile. At this point, I will go ahead and put my sterile gloves on. The sterile glove that come in with that kit doesn't fit my hand, so I'll go ahead and put on one that I got from storage. Now turning my back to my sterile field. Make sure I do this one first, then this so it doesn't flap back. So now I'm going to start with putting the gloves on my dominant hand first. I'm going to take my non-dominant hand, hold by the cuff, and carefully place on my dominant hand. Then I'm going to do two fingers inside this one. So now that I got my sterile gloves on, come back to my field. Now everything right here is sterile. So I got my sterile gloves on, so get my absorbent pad, right? I'm going to carefully place it under the patient without my sterile gloves touching the sheet or anything. Okay, so now that I have carefully extended my sterile field, I can now proceed on with my procedure. With this, we can use these sometimes over the patient, but with a female patient, I'm not going to. it's more ideal with a male patient. So I'm going to carefully rest this right here at the side. I'm going to have my cotton swabs. Make sure that I have a good amount of access to them. I'll place them right here. Make sure I put my lubricant for my Foley right here. Right, then now we're going to test the balloon to make sure it works before inserting in the patient. So I'm going to carefully take this part off. Press it right here. And get my syringe. Now there is 10 milliliters or cc's of fluid in my syringe, so I'm going to carefully note that that's the amount we're putting in. So now it's time to test my balloon. My balloon seems to be working, so now I'm going to let gravity pulls back the fluid. Now we could let this syringe stay on this part, or we could take it off, but for this video purpose I'm gonna make sure it stays on, because while doing the Foley one of my hand will become non-sterile, so I don't want to risk my sterile feel. Make sure that 10 cc is coming back. Okay, so I'm gonna carefully place it right here. So now I'm gonna use my non-dominant hand and make sure that I clean my patient properly. So I'm gonna touch my patient on her perineum area and start cleaning. Start from the outside. And I'm going to go on the inside. Then I'm going to do one swipe in the middle. And it's careful to note that while doing this procedure, you communicate with your patient to make sure that they're comfortable and all of that. So now we're going to lubricate the tip of our Foley. We're going to carefully lubricate without breaking sterility. Now that my Foley has been lubricated, I'm going to tell my patient to inhale, and then while she exhales, I'm going to insert. So I'm going to carefully insert up to 3 to 4 inches until I meet resistance. I'm careful so I don't break sterility. Right now that I've meet resistance, I can now use my hand that become not sterile and hold right here while I insert my fluid to inflate my balloon. Once I've inserted my fluid, I'm going to carefully take this part off and pull out until I meet resistance. So now that I meet resistance, I can now take my sterile gloves off because the sterile procedure is done. Once I take my sterile gloves off, I'll then wash my hands. And in some hospital settings, they require us to tape this part onto the patient's leg with, you know, not being too tight but loosely. But for this video purpose, we're not going to do that. Then I would record the amount of urine that came in, the date and the time, the color, right? Or if it has any odor, and I will put it on the side of the bed right here. So that's it for the insertion, my insertion of a Foley catheter. So now I'm going to show how we carefully remove a Foley catheter, right? So I've got all my supplies that I needed. So I need my 10 milliliters or cc syringe, because that's the amount of fluid that we inserted in the balloon. We're going to need an absorbent pad just in case the patient doesn't have one underneath them on the bed. We're going to need wipes if the patient perineum area needs any cleaning, stuff like that. So before I enter my patient room, I'll wash my hands. Make sure I create privacy for my patient. Then I'm going to go introduce myself to my patient, check his name and his date of birth, or in this case, her name and her date of birth, to make sure I have the right patient. Make sure she verbally tells me her name and date of birth as well. Then I will make sure I tell her my name. Well, I'm Ushin Walker, your nursing student, and I'm here today to remove your Foley catheter. Okay, so I make sure my patient has a bed bath blanket to make her feel like she's being covered, she's in the correct position. She doesn't have an absorbent pad underneath her. So I'm gonna go ahead, wash my hands one more time, put my clean gloves on. This procedure is a clean procedure, not a sterile procedure, so that's why we're using clean gloves. I have my syringe and I have my absorbent pad. I'm going to just carefully place it underneath my patient. Then I'm going to attach my syringe to my Foley and let gravity pulls up all the fluid. And when inserting the Foley, we documented that it was 10 cc's inserted, and we should get 10 cc's back. So now that I've gotten all my fluid, I could carefully take this off, put this back on, rest this right here. Then I'm going to tell my patient to inhale and exhale while I carefully pull this out. Then I'll wrap this in my gloves, take my gloves off, just to prevent it from flashing back and forth. Then I'll put it in my dumpster. And that will be it for the removal of a Foley catheter. Thank you.